Not only do we need to do our part to implement the provincial directive, Directive number 6 from the Chief Medical Officer of Health, and that is the minimum, but ultimately, as the largest employer in Hamilton, I think we also need to be a role model and demonstrate leadership in our community and in our region.
The Chief Medical Officer of Health has directed all public hospitals to implement these precautions that you'll see set out in the policy that's now available on our policy library. So HHS and our people are required to abide by that policy. What about people who work from home or work remotely? It applies to everyone regardless of where you're working. It's all being collected and managed under the Occupational Health and Safety Act and safeguarded in accordance with our PHIPA best practices. Your vaccination status information and documentation will be shared in aggregate with the Ministry of Health, and that's right in Directive 6. It's a requirement to comply with the provincial reporting requirements under the directive.
Leaders who have staff that have not yet reported will be receiving a list of individuals who have not yet completed the education that are required to do so, and that education module must be completed by September the 24th. In addition, for those who are not fully vaxxed, will also be required to complete home testing. So this will be required twice a week, Mondays and Thursdays. That information and all of the instructions on how to administer that test, which is quite easy to do, as well as how to report the results, are included directly in the kit.
As with all of our HHS policies, compliance with our vaccination management policy is required. Failure to comply with the policy may result in an unpaid leave of absence until the individual becomes compliant, and may also result in progressive discipline up to and including termination for that ongoing non-compliance. We are giving folks reasonable time to become compliant with our policy. Effective September 21st, compliance is required. All staff and physicians must be in compliance in either the reporting of their status, or for those who are required to test, is those folks are testing on that periodic basis set out.
The same applies to physicians as it does to other staff. So yes, where there is non-compliance with the policy, physician leaders will follow up with the physicians on that, just as will happen with managers and directors with other staff.
Just a little bit of detail around our ED volumes that we're seeing right now. We have gone back to our 2019 volumes. So in 2020, we saw a bit of a dip in our activity of about 20%, and we have now gone back to seeing those patients again and a little bit beyond that. So I know our EDs are feeling the pressures. We have not yet resumed all of our pre-COVID surgical activity, so we're already operating below our general activity at our sites, yet feeling the pressures that we have had. We are working with our regional partners as well. Everyone is feeling much of the same stress, but we are looking to opportunities to manage and census balance across our sites as well.
We are doing the best we can in an imperfect situation, but I do believe what we are doing is the right thing to do. We will continue to monitor the outcomes of the current policy and make adjustments as appropriate. Thanks all for attending today, and we'll see you next time.